Good morning, everyone, and thank you for your patience. We were sorting out a few technical difficulties. Always love when technology works how we hope it will. Um, my name is Ali Fogarty. I'm the Communications Director here at DHS. Thank you for registering for and attending our 2025-2026 budget presentation. We will start with an overview of some of this work and some of the initiatives from Secretary Arkoosh. And then with the time we have left at the end, we're going to try to keep this to about an hour, but recognizing that we started a little bit late, we'll see what we look at where we are at 11 o'clock. We're going to take a few questions. So thank you to those who submitted. If we do not read your question, we got a lot submitted. Please continue to follow up with your program office contacts over the next few weeks and months. Obviously, a lot of this is new information for all of us, so there will be more details that we can share as we get closer, move through budget season. And also, we will be recording this presentation, so if you do not consent to being part of the recording, please depart now. The recording will be posted on our YouTube page either this afternoon or Monday, and we will also send out the link to all registrants when it is posted, so you have it. And one last housekeeping note, there is a Q&A option. Like I said, we're not going to likely be able to take live Q&A from that. But if you send questions as you have them, we'll collect them and get them out to your program offices so they know the kind of questions that you have, and we can continue to answer those and provide updates over the next few weeks. So with that, I will turn it over. Were we able to get the interpreter pinned?
Unfortunately, no, we are not at the moment. I'm working on this.
Okay. We're hoping to have ASL interpretation on the screen as well, so just bear with us as we get that set. But with that, I will turn over to Secretary Arkoosh to get us started.
Thanks, Ali, and good morning, everybody. Welcome, and thank you for spending some of your precious time with us here this morning to hear a little bit about Governor Shapiro's proposed budget for 2025-2026. I do want to acknowledge that this is being recorded on the Friday before the Super Bowl, and that I am wearing green in support of my favorite football team. So for those of you who see this after the football or after the Super Bowl, hopefully my green was good luck for my very wonderful Eagles. So as you know, we are now 2 years into the Shapiro administration with a governor who is focused every single day on GSDing. And if you don't know what GSD means, ask a friend. Before we dive into what's ahead, I do want to take a few minutes to reflect on the first 2 years of this administration, acknowledge the incredible team that I have the honor to work with every single day, and just briefly talk about some of the stuff that DHS has gotten done and the new ways that we're here when Pennsylvanians need us. We finished the all hands on deck marathon that was Medicaid unwinding on time and under budget with the 5th lowest procedural termination rate in the United States. This success would not have been possible without the broad outreach strategy that so many of you were part of, and thank you for that. Last summer, we launched our inaugural Sunbucks program. We only had about 6 months to stand it up, but we got it done. And that meant that last summer, 1.2 million children across the Commonwealth were able to get a little extra help with food, access to food during those summer months when school is out and their school breakfast and school lunch programs aren't available. We have transformed our system for supporting children and youth with complex needs, so complex that they often end up in a hospital emergency department for weeks at a time with no place to go. We've provided technical assistance to local planning teams to support over 230 youth with complex needs and their families. And we've developed and published the Blueprint Report, which is our roadmap built in collaboration with multiple partners to create the infrastructure to support these youth and continue those discussions to develop and implement system-changing recommendations. And we launched the first annual Pediatric Capacity Building Institute to help make sure that the workforce is there to care for these kids. And we had 30 participants who worked over 9 months as part of this program in our first year. Very exciting. PA Navigate has launched. This is our closed loop referral system for health and social services across the Commonwealth. And if you're not familiar with it, please check it out and make sure that your organizations are part of this network. You can find it at pa-navigate.com. That's pa-navigate.com. Our Division of Emergency Planning and Response has expanded disaster response and recovery tools to include coordination with 211 and more on-the-ground supports with FEMA. This team also hosted a national preparedness exercise in May of 2024, bringing together representatives from 15 states, federal partners, and private sector relief agencies for a 4-day exercise at Shippensburg University. To address maternal mortality, we've expanded access to doula care in our Medicaid program, invested in partners who provide outreach, care, and support to pregnant and parenting people in all communities, and we're finalizing development of a maternal health strategic plan that will chart a course for this work moving forward. The Office of Child Development and Early Learning updated our child care subsidy regulations and established a new division focused on program and service quality in OCDEL's Policy and Professional Development Bureau. And we significantly increased capacity at our state-operated juvenile justice facilities, expanding treatment and care options and reducing wait times for youth that are adjudicated to our care. We eliminated our provider enrollment backlog in the PROMISE system. That's the technical backbone of our Medicaid system. And we are in the middle of a massive modernization program for that system. Our Office of Developmental Programs received federal approval to implement performance-based contracting for residential services, shifting our approach and investing in service sustainability and quality of care for Pennsylvanians with intellectual disabilities and autism. We successfully implemented electronic health records at our 6 state hospitals for the first time. The OMSAS team led this work. They led all of the project management support, and they got this project done on time and on budget. In fall of 2023, we changed our Medicaid program to allow certain Medicaid enrolled providers to bill for services rendered outside of a traditional brick and mortar clinical setting. This practice, which is known as street medicine, helps people who are unhoused and face the serious life-threatening risks that homelessness exacerbates. They can get care sooner, and it helps to build trust that encourages more regular care. Street medicine's not new, but this change has meant that providers can do this outreach for the first time and be reimbursed. Historically, this has always been groups of volunteers that did this work. So if the individual that they're assisting is enrolled in Medicaid, now they can be reimbursed. Pennsylvania was one of the first states to allow this, and as of October 2023, the Centers for Medicare and Medicaid Services are allowing it nationwide because of the success and positive impact that this practice has. We also launched the Women's Health Services Program Grant, which funds 6 regional leads who are providing a range of services that can include nutritional support and education, mental health and emotional support services, safe and stable housing, pregnancy and parenting education, transportation services, menstrual hygiene products, and more. And we continue to build out our Community Health Choices program with the first re-procurement of this program during 2024. More than 76% of long-term services and supports participants are living in their communities. We are focusing on enhanced quality measures, and programs are getting results with an overall 5% reduction in strokes, and one managed care organization has seen a 33% reduction in falls through their very focused women's health initiative. I share each of these not just to brag, but I'm bragging a little bit, but I want to make sure that you all know how proud I am of this team, and this work represents the work of folks at all levels of the Department of Human Services. But I also want you to hear the many ways that each of you and the organizations that you represent support this work. You do that through your advocacy, through your on-the-ground work with us, and I just want to thank you too. We could not get this done without all of you. These accomplishments are things that we do together. And so as we engage in this budget cycle and acknowledge the uncertainty of what lies ahead at the federal level, I hope you'll join me in using your voices to champion the tangible results of our work and lift up the importance of ongoing investments as we continue to build bridges to success for the Pennsylvanians that we serve. So, on to the governor's budget. You're going to see a slide there with a whole bunch of budget themes listed on it. On Tuesday, the governor outlined a bold plan to build on the progress that we've made during this past year by continuing to invest in Pennsylvania's economic vitality, support stronger schools at all levels of education, strengthen our communities, and promote opportunity for every Pennsylvanian. And there's a lot more, which you can see on these slides. This budget sets out investments and solutions for challenges that face every county and every community across the Commonwealth, and will set a course to make Pennsylvania a competitive, attractive state to live, work, and thrive in. Governor Shapiro's 2025-2026 budget spans various themes and broad goals, which you can go through in some detail when you have a little more time. But these themes come down to a singular unifying mission, and that is to build a Commonwealth that invests in well-being, opportunity, and the future for all of us. For the 2025-2026 budget, the governor is proposing a Department of Human Services budget of $21.17 billion. This is an increase of $1.95 billion over our available budget for the 2024-2025 state budget year that we're currently in. This funding is split between $1.8 billion in new funding to maintain existing programs and $150 million in new initiatives. You'll see on this chart that our Medicaid program represents the largest portion of our costs, with long-term living, physical health, and services for Pennsylvanians with intellectual disabilities and autism representing the largest portions. Today, 2.9 million Pennsylvanians, 2.9, or nearly a quarter of our population, get their health care through Medicaid. And about 750,000 Pennsylvanians are covered through the Medicaid expansion. This was an option that was created under the Affordable Care Act. When the Affordable Care Act was passed in 2010, Pennsylvania's uninsured rate was 10%. By 2023, that number is down to just over 5% because of Pennsylvania's work to implement Medicaid expansion and embrace a robust individual insurance market overseen by Commissioner Mike Humphreys and our colleagues at the Pennsylvania Insurance Department, and made accessible to Pennsylvanians by Penny. And Penny is Pennsylvania's insurance marketplace. Not only has Medicaid expansion enabled 750,000 Pennsylvanians to have the stability of affordable health care, but as of 2023, hospital uncompensated care is 27.7% less than it was prior to the Medicaid expansion, even as healthcare costs have increased during this time. As a reminder, the cost of Medicaid is shared between the federal government and the state of Pennsylvania, with the federal government paying a little over half of the cost of the traditional Medicaid program and 90% of the costs for Medicaid expansion. I also want to give a shout out to our small but mighty, and it's a small but mighty sliver on this chart, and that's our Office of Income Maintenance. This office operates all of our county assistance offices, oversees a variety of workforce development programs, and manages family stabilizing programs like the Supplemental Nutrition Assistance Program, commonly known as SNAP. SNAP is a federally funded benefit that contributes nearly $367 million each month to Pennsylvania's economy and helps more than 2 million people purchase food. While we work in close partnership with our charitable food network, this network could never replace SNAP. For every meal provided by the charitable network, the SNAP program provides 9. Amidst federal funding conversations, it's important to keep in mind the potential of various proposals on Pennsylvanians. To learn more about Medicaid and SNAP, who is covered, where they live, you can go to dhs.pa.gov/data. That's dhs.pa.gov/data. I urge you to check it out. And regardless of what is swirling around us, Governor Shapiro, this administration, and all of us at DHS are ready to meet this moment. We will remain laser focused on the everyday issues facing Pennsylvanians: health inequity, costs of care, access to and quality of care in all communities, rural, suburban, urban, and others. On our next slide, we're going to highlight the governor's proposals for further investment in our ongoing proposals, and then we'll get to new initiatives in a few minutes. All 3 of our Medicaid managed care programs, known as Community Health Choices, Physical Health Choices, and Behavioral Health Choices, as well as our waiver programs for people with intellectual disabilities and autism, are seeing increases that are largely driven by rising patient needs and costs associated with delivering their care. Oftentimes for vulnerable populations like older Pennsylvanians, people with disabilities, and people with complex and chronic health care needs. But we also want to highlight that we continue to engage with our stakeholders to improve our programs with targeted interventions and supports that contribute to our goal of keeping cost increases as low as possible. For instance, Community Health Choices serves our lowest income older adults and individuals with disabilities and is the newest of the 3 Medicaid programs. Community Health Choices includes quality incentive payments for our nursing homes and pay-for-performance incentives for managed care, both of which work to shift our programs to better outcomes. Funds for Community Health Choices cover the work of the Pennsylvania Independent Enrollment Broker, which supports applicants as they apply for and select the best Office of Long-Term Living program for their needs. We have newly implemented beneficiary support services as part of the Independent Enrollment Broker services. These services will help people navigate access to home and community-based services. We've brought back chore services and expanded teleservice options to support folks who choose to live in the community. Funding in Community Health Choices helps coordinate transitions from nursing home care to community-based settings when appropriate. And it also supports legal aid programs that help applicants and participants navigate often complex, overlapping systems of care. In the years since CHC was implemented statewide, we have seen the rate of costs for serving this population slow. And as I mentioned earlier, Community Health Choices continues to deliver on helping people stay in their communities. More than 76% of participants are receiving services in their communities, exactly what the CHC structure was in part designed to help accomplish. CHC is managing service utilization and investing in strategies that both improve quality and value of care, helping Pennsylvanians age and live with dignity. As our hospitals and other providers continue to recover from the substantial financial impacts of the COVID-19 pandemic and the rising cost of certain treatments, our Physical Health Choices program will also see increased investment to meet these needs. My team works every day to balance connecting Pennsylvanians to the healthcare they need with ensuring that taxpayer dollars are being spent effectively and efficiently. Like many other health systems and payers, we're seeing a substantial increase in the prescribing of GLP-1 medications for specific conditions such as diabetes and also for obesity. DHS is evaluating how GLP-1s are being prescribed through the Medicaid program, particularly for obesity, and we are considering opportunities to alter prescribing and coverage guidelines. We will engage with our partners for feedback as we explore and develop next steps. Let me turn to some updates around the 1115 waiver. As many of you know, and as many of you assisted with, last year, Pennsylvania announced our intent to pursue an 1115 demonstration waiver targeted toward health-related social needs. For those not familiar with this process, Section 1115 of the Social Security Act gives the federal government the ability to waive certain federal rules that govern Medicaid to allow states to design and evaluate new state-driven pilot projects that promote the general goals of the Medicaid program to help people live healthier lives. Approved 1115 waivers operate as a 5-year pilot with independent evaluation requirements included to measure the effectiveness of the demonstration. These waivers are a major pathway for state innovation in the Medicaid program. In early 2024, the Department of Human Services submitted our 1115 application called Bridges to Success, Keystones of Health. Our proposal spans 4 areas of focus: housing, nutrition and food as medicine, re-entry supports, and multi-year continuous eligibility for children up to age 6. We are pleased to share that the full package of proposals was approved by the Biden administration. However, as we look forward to implementation, we do so in an environment of uncertainty. We are just 3 weeks into the new Trump administration, and at this moment, we do not have certainty about how this administration will work with states to leverage federal funding for the innovations envisioned in our 1115 waiver. Because of this uncertainty, we are moving forward, but in a stepwise fashion, starting with the initiative focused on reentry for individuals leaving correctional institutions. This part of our 1115 waiver is built on the foundation of the Bipartisan Support Act, passed in 2018 under the first Trump administration. Through this act, Congress directed CMS to develop demonstration projects to improve care transitions out of correctional institutions with the goal of improving outcomes for re-entrants. If approved in the 25-26 budget, this waiver will provide pre-release coverage, which means up to 90 days prior to release from a state correctional institute, for substance use disorder, including medications for opioid use disorder, intensive case management to support warm handoffs for post-release clinical and social services to improve continuity and reduce recidivism, and 1 year of continuous Medicaid eligibility. Similar programs are proven and have reduced overdose deaths, improved health outcomes, and reduced recidivism following community reentry. This initiative would start in state correctional institutions in 2026 and focus on justice-involved adults with serious mental illness, substance use disorders, serious chronic illnesses, autism, and/or are pregnant. The 2025-2026 budget includes $4.8 million in state funds, which will allow us to leverage federal funding for a total of $15.7 million to launch and implement the pre-release Medicaid coverage and case management services to ease reentry and improve transitions for reentrants. The Department of Human Services and the Shapiro administration remain deeply committed to the Keystones of Health project and initiatives and the vision behind this work. Research demonstrates that social determinants of health, like healthy food and housing, account for 50% of geographic variations in health outcomes, compared to clinical care, which accounts for about 20%. The Keystones of Health strategies put forward and approved by CMS were based on initiatives proven to improve health outcomes and slow healthcare spending for people with chronic health challenges. We are going to continue our internal work to prepare for an eventual implementation of the full waiver, and there will be more opportunities for engagement and your feedback in these preparations. We urge all of you that have been engaged in this process to continue to educate legislators and stakeholders about all parts of Keystones of Health and share how implementation will positively impact your work and the people that you serve. My team is developing an advocacy guide, which will contain fact sheets, talking points, and more resources about all parts of the Keystones of Health program. Reentry supports, food as medicine for people with certain diet-sensitive chronic conditions and those who are pregnant and postpartum who are experiencing food insecurity. Housing supports for people with behavioral health needs or disabilities experiencing or at risk of homelessness, and continuous coverage for Medicaid-eligible children up to age 6. We expect to have these resources ready in the next month or two, and we hope that they will be a valuable tool in leading conversations about why these initiatives are important and necessary. So thank you for your continued support of Keystones of Health so far. This work can and will make a difference, and I look forward to moving forward on the reentry supports piece this year and the rest of the demonstration waiver in the near future. Continuing along with some of our budget initiatives, last year, under Governor Shapiro's leadership, the Department of Human Services Office of Developmental Programs embarked on a major shift to service delivery for Pennsylvanians with intellectual disabilities and autism, committing to end our emergency waiting list for adults. Through tireless advocacy from this community and in partnership with the General Assembly, we were able to invest $354.8 million in federal and state funding to provide more resources for home and community-based service providers. The funding included $280 million to help raise wages for direct service providers, called DSPs for short, and $74.8 million to begin the process of eliminating the years-long adult emergency waiting list for services. And we are quickly seeing the impact of this historic investment. In the years since the governor announced this new strategy, we have reduced the adult emergency waiting list by 20%. 20%. The emergency waiting list had been steadily growing for years, and this quick shift is exactly what we hoped this investment would achieve. The administration has made significant investments to raise the wages and better support the dedicated workforce, those DSPs, that serve this community. Providers have made great use of these funds for recruitment and retention, with a recent workforce survey showing that the DSP vacancy rate is 14%. That is the lowest that it has been since 2015. The 2025-2026 budget continues our commitment to this multi-year program growth strategy by annualizing the rate increases and the waiver enrollments from 2024 to 2025. This is coupled with the shift to give counties more flexibility by managing to a budget rather than to slots. We expect to see the progress made in year one to reduce the emergency waiting list and serve more people with similar issues on that waiting list to continue to decline. To date, this fiscal year, ODP has grown the waiver capacity by 1,300 individuals. So we're so excited about this work, and we look forward to continuing to bring that waiting list number down. We are also continuing our commitment to increase county mental health-based funds. The 2025-2026 budget continues the Shapiro administration's commitment to our behavioral health system of care by investing in county mental health programs. We've taken big steps since 2023 to begin to right-size this funding after more than a decade of neglect and cuts, with $40 million of new funding. The governor's proposed budget continues this progress with an additional $20 million investment for a total of $60 million increase since the start of this administration. As a former county commissioner, I saw firsthand how the lack of funding imperiled services to county residents. I know the challenges and limitations that our county partners must navigate every single day because of years of continuous disinvestment in this system of care. We look forward to continuing this commitment to our county partners and the work that they do so that they can continue to be there for their communities every single day. Beyond the county behavioral health programs, many of our counties work with behavioral health providers and other partners, like law enforcement and their local 988 Lifeline call center, to respond when needed to crisis situations. Our 988 workforce do heroic, life-saving work 24/7 by providing compassionate support for more than 10,000 callers every month, 10,000 callers per month. Although the majority of 988 calls can be handled on the phone without needing to deploy a crisis team, these resources are sometimes necessary. When behavioral health crisis response is unavailable or inadequately resourced, people in crisis may turn to an emergency department, which is not equipped to handle a behavioral health crisis, or risk unnecessary law enforcement involvement and potential incarceration. A comprehensive crisis response system offsets strains on other emergency response systems and ensures that people who are trained to respond to a behavioral health crisis are able to respond, to be there when that help is needed. The 2025-26 budget seeks to support these resources by investing $10 million in 988 Lifeline operations at our 12 call centers in Pennsylvania, and will build on investments from last year by continuing to support crisis stabilization in communities that are currently under-resourced. This administration continues to be focused on stabilizing families. Groundhog's Day was last Sunday, but for 16 years now, Pennsylvania continues to repeat ourselves in another way, an abysmally stagnant minimum wage. As the Eagles prepare for Sunday's Super Bowl, let's take a few minutes to remember what the world was like when our minimum wage last increased to, where it is right now today, $7.25. It was the last time that we could refer to the Pittsburgh Steelers as the reigning Super Bowl champions. Donovan McNabb was still quarterback for the Philadelphia Eagles, and the Eagles had just drafted a future NFL rushing yards leader, Harrisburg's own LaShawn McCoy. Children born in 2009 are getting their permits this year, but our minimum wage is unchanged. A stagnant minimum wage hurts Pennsylvania's competitiveness, especially as all of our neighboring states have taken steps to invest in their workforce and their economies. The governor's budget projects that an increased minimum wage could generate $100 million in increased revenue to the Commonwealth by increasing our residents' purchasing power. Research demonstrates that increasing the minimum wage will also have a greater benefit on women and workers of color, who are more likely to work in lower income jobs that play important roles in our economy, and particularly in our human services systems, especially our caring infrastructure. We cannot continue to lag behind on this. It is beyond time to act. Continuing in the theme of building opportunities for our future, I want to just touch on the proposal to increase early intervention rates. The proposed 2025-2026 budget seeks to invest in care and support for our youngest Pennsylvanians by investing $10 million in state funding to draw additional federal funds for a total of $22.6 million for early intervention rates. This rate increase will support the early intervention workforce and help children and families who qualify for these services get high quality care during the critical early years of development when these services have the greatest impact. This is an investment in the lifetime success of the children who need these services. We're also taking a look and tackling a number of Commonwealth-wide challenges. Many of you are very aware that a number of our hospitals around the Commonwealth, many in rural settings, but many in suburban or urban settings, are facing very serious financial challenges. Last year, the Department of Human Services was allocated $10 million in the 2024-2025 budget, the budget that we're currently in, to help stabilize rural hospitals in particular. This was an investment of state funds that enabled the Department of Human Services to draw federal matching funds for a total of $36.7 million to support access to hospital care in rural communities. The governor is proposing to continue his support of rural hospitals through an additional $10 million investment in 2025-2026 that will allow us to leverage more federal funding for a total of $35.1 million for rural hospitals. Additionally, and very importantly, the governor is also proposing $10 million in state funds to be used to support hospitals across Pennsylvania. This investment will allow us to leverage more federal funding for a total of $35.1 million for additional hospitals. The governor's budget also continues our work to support transitions to community-based placements for people receiving care at our state hospitals, with funding to move 20 non-forensic state hospital patients who could be treated in the community to less restrictive placements, allowing state hospitals to do what they were built to do, and that's to serve patients with the most acute needs. $1.6 million will support 20 more people being served in the community in counties across the Commonwealth through the Community Hospital Integration Project programs, the shorthand of which is CHIPS. The budget also includes $5.75 million to support community-based placements for people determined to not require forensic treatment in a state hospital, to prevent delays in admissions for others who do require competency determinations or restorations in one of our state hospitals. When it's determined that a person is able to begin treatment in a less restrictive setting, or step down from state hospital treatment to a community-based placement, but has to remain in the hospital due to lack of community-based options, it creates a backlog across our system, particularly for other forensic admissions. This delay can cause justice-involved people to remain incarcerated in county correctional facilities where they're not getting treatment, they're simply awaiting care. Greater support is necessary to provide appropriate care for this highly vulnerable population and ease the burdens on our county prison systems. We also want to circle back for a moment to some of our pressing and been pressing since COVID workforce issues. And first up is our childcare workforce. The Shapiro administration has made supporting access to high-quality, affordable childcare a priority since day one. Childcare is the cornerstone of our economy. Parents cannot go to work and invest in their own future and their family's future if they can't afford or can't find childcare for their kids. The Pennsylvania Chamber of Commerce has estimated that a lack of childcare options in our state can collectively lead to $3.5 billion in lost wages, revenue, and economic activity for Pennsylvania. And these investments benefit our communities for years to come by providing critical social, emotional, and educational development for our youngest Pennsylvanians. Last year's budget secured investments that increased child care works, our base reimbursement rates, to the 75th percentile of private pay rates. What this means is that it will bring more funds to providers that participate in child care works and support lower income working families and help Pennsylvania meet the federal government's best practices for the first time. For many lower income families, they can't afford childcare. They don't make enough money to afford childcare without the Child Care Works program. So we are so grateful for the providers that participate in this program, and we are so pleased that we are able to now reimburse providers or provide funds for those providers at that 75th percentile. Governor Shapiro has also expanded Pennsylvania's dependent care tax credit for families paying for childcare and established a new tax credit for businesses who contribute to their employees' childcare costs. And we certainly urge any of you who can do that to take advantage of that tax credit. This year, we're looking to continue our support to this vital workforce. The 2025-2026 proposed budget includes $55 million to enable licensed child care centers who participate in child care works to give a child care worker a recruitment or retention bonuses of at least $1,000. The child care workforce dedicates their lives to our children, giving a peace of mind that I know many of us who are parents have felt firsthand. The least we can do is help them live with the security that they too deserve. Building on the Shapiro administration's support for the caring workforce that we have demonstrated since taking office, the 2025-26 budget proposes increasing rates for direct care workers working in community health choices under the participant-directed model of care. Participant-directed services allows community health choices participants to directly hire and employ their direct care workers. This gives participants the most control over how they receive these services, and it puts the most dollars directly into the pockets of those direct care workers. The Community Health Choices Managed Care Organizations assist participants by facilitating administrative supports that are part of the employer-employee relationship between participants and direct care workers. $21 million of state funding will allow us to leverage federal funding for a total of $47.8 million to increase wages for direct care workers, support paid time off for the first time, and increase access to affordable health insurance for approximately 8,500 direct care workers who help older Pennsylvanians and adults with physical disabilities remain in their homes across the Commonwealth. Also, to assist our nursing home partners working to reach staffing ratios dictated by federal rules, the 2025-2026 budget proposes investing $15.3 million in state funds to combine for a total state and federal investment of $34.8 million to support staffing at nursing homes. And one last thing. While this is not a direct Department of Human Service budget item, it will have a very positive impact on building stability for the individuals and families that we serve. Governor Shapiro called for sealing eviction filings when a judge rules in favor of the tenant. In 2024 alone, more than 1,115,000 tenants in Pennsylvania faced eviction filings. But about a quarter of these end with a ruling that favors the tenant, and some are never even adjudicated. Regardless of the outcome today, that original eviction filing stays in a tenant's public record indefinitely and often negatively impacts their ability to find a place to live. If the finding was not against the tenant, as the governor said, it's just common sense to seal these records. So I hope this presentation has given you a sense of the incredible opportunity presented in the governor's budget to continue to build and fortify strong bridges to success for people and families across our Commonwealth. This is our commitment to Pennsylvanians always. Proposing a budget is just the first step. If there are initiatives in this budget that will help you or your community, opportunities that you're excited about, please let your state senator and state representative know. Tell a neighbor, write an op-ed. Budgets don't pass themselves. So thank you again for joining us today and for taking the time to submit questions. As a reminder, the Blue Book will be published on the DHS website in the next 2 weeks. And I do just want to give a huge shout out to my whole budget team. They work tirelessly this time of year to work with the governor's budget office to prepare this Blue Book. It is a tremendous amount of work, and that is all led by our fiscal manager, Gloria Gilligan. But I want to thank her and her whole team for the incredible work that they do every single day. And you'll be able to find out a lot more granular information about all of these initiatives and investments in our Blue Book. And you can also take a look right now at the governor's executive budget at budget.pa.gov. So we will now walk through a few questions that were commonly asked by individuals who registered to attend today. And then, as Allie noted at the top of this, go ahead and put additional questions in the Q&A, and we will do our best to get responses out in the next weeks. So the first question is,
we have something that was probably our most commonly asked question. I'm sure a lot of you are thinking about, how is federal activity in DC affecting funding for DHS's programs?
Right. So as I alluded to earlier, there's a lot coming out of Washington right now. I want you to know that we are closely monitoring the executive orders signed by President Trump, as well as numerous proposals that are being discussed in the media by the president, his staff, or members of Congress to understand the implications and impacts to our programs as quickly and thoroughly as possible. As we have tangible details, you'll hear from either me or the leadership in our program offices. But just bear with us. We know that these situations are very much in flux right now. And so we do appreciate your patience as we kind of work through the turbulence. We want to be really clear to identify actual risks once they have been put into a proposed piece of legislation or into a proposed budget package. And as we identify that, we'll be sure to let you know. And I also want to just remind you about dhs.pa.gov/data. By going there, you will be able to see a lot of pretty granular information about Medicaid and SNAP. It's listed by congressional district, state Senate district, state House district, and by counties. And so you can get a real good sense of what some of proposed cuts and then if things that are proposed are actually included in potential legislation, what that could mean for the communities that you serve. Next, Allie.
Great. Next we have, does this budget include funds to put chips on EBT cards to help address the scourge of SNAP skimming?
Yeah. So great question. We recognize that EBT card security and skimming are growing concerns nationwide, unfortunately, including right here in Pennsylvania. We are on top of this issue. We are working every day to educate SNAP recipients through direct text message outreach to them, through social media, through regular traditional media and other challenges to help them avoid thefts. These benefits are life-saving benefits, and we want to make sure that every SNAP recipient eligible for their benefits is able to use them. We have begun sending out text alerts reminding users how to be safe when swiping their cards and to recognize these skimming devices that are often literally inserted into the credit card slot that you put your card into. And we want people to look for those skimming devices before they ever insert their card into one of those terminals. We have also enhanced security by not allowing a simple PIN like, 1111. Now it has to be a little more complex than that. And we're actively working with our EBT vendor, Conduit, to implement additional security enhancements, such as allowing users to disable their cards via the app that all of our users have access to. Here at DHS, we can't stop this fraud alone. We really need our SNAP retailers, and there are 10,000 of them. So, it is a real economic stake for them too. Just here in Pennsylvania, we have 10,000 SNAP retailers. We're asking them to be extremely vigilant to protect their point of sale devices. We're also very willing to work with the General Assembly to explore additional options to strengthen card security, including the potential funding that we would need to purchase and implement chipped EBT cards.
Thank you. I know we're at time, but we have 2 quick questions left, so we'll do those and then wrap up.
Okay.
For intellectual disability services, there is a line item placeholder indicating $175 million. Does this reflect new funds or the cost of maintaining current programs but not serving new individuals or services?
Yeah, sure. So as I mentioned earlier, the 25-26 budget proposes annualizing the rate increases secured last year that have expanded overall waiver capacity by 1,300 people. With normal waiver turnover and our counties fully transitioning to that managing to budget rather than to slots that I mentioned earlier, we expect this trend of increased capacity and new enrollments to continue.
And then our last question, what new investments are being made in maternal health?
So right now, there's no specific new funding, but the budget continues funding for our women's services grants that I mentioned earlier and went through some detail about what those grants provide, and funding to implement recommendations from the Department of Health's Maternal Mortality Review Committee. We also now cover doula services and Medicaid. All of these initiatives are new under the Shapiro administration. And stay tuned because very soon we will be putting out for public comment and collaboration our maternal health strategic plan. We hope to release it this spring. This plan has been built after, I think we've done 12 or 13 listening sessions around the Commonwealth, just hearing from folks on the ground, people that are pregnant or recently pregnant, about the challenges they're facing and how we can help them have just a little bit easier time in their pregnancy and ensure access to the services that they need. This is a very active and top of mind priority for us here at DHS. So again, stay tuned. There's a lot more to come in this area. So I think that's it for today. Thank you all so much for joining us. I want to thank Kim, our ASL interpreter, and I'm sorry we had a little trouble getting you started at the top, but I'm glad you made it. And again, thank all of you. Please share the link for this with your friends, colleagues, neighbors, coworkers, with the folks you serve. I'm just going to say it one more time. The governor proposes the budget. The General Assembly passes it. And we need your help to make sure that we get all these initiatives across the finish line. Thank you for your partnership. I look forward to continuing to work with all of you in the weeks and months ahead. Take care.
Thank you again, everyone. As a reminder, this recording will be posted on our YouTube either this afternoon or on Monday, and we will also send the link out when that is ready for you to view and share. Thank you again for joining us, and have a good rest of your day, and go Birds!